Hello everyone, welcome to the 5th video session in our chronic pain management series. The topic for today is trigger point therapy. The purpose of this session is to teach you how to locate and perform self-massage to your trigger points to provide pain relief. During this session, we will start by defining trigger points and their many causes. Next, we will go over safety and guidelines for performing self-massage. Finally, in part 2 of this topic, we will provide step-by-step instructions for performing self-massage on a few different trigger points. So what are trigger points? Trigger points are localized spots of extreme tenderness in a taut band of muscle. If you look at the top right illustration, this is what a muscle looks like. You can see there are a bunch of tube-like portions inside the muscle, which are the bands I referred to. When these bands become too tight for a long period of time, they create little knots, which become the trigger points. Trigger points become painful when you press on them. Trigger points can be hard to find because they are very specific, small spots on your body. However, there are a few tricks to finding them. You know you have found a trigger point when you can press on it multiple times and produce the same pattern of pain. When you are pressing on a trigger point, you may also observe your muscle twitching. Trigger points have a few different classifications. First, trigger points can be active or latent. Active trigger points cause spontaneous pain with or without motion. This means that you do not have to press on an active trigger point for it to cause pain. Latent trigger points only cause pain when pressed on. Latent trigger points are much more common, but if left untreated, can become active trigger points over time. Second, trigger points can be primary or satellite. When left untreated, primary trigger points can become worse and cause other bands of muscle to become taut, leading to even more trigger points. These new trigger points are called satellite trigger points. Trigger points can be caused by a variety and combination of different things. Muscle abuse is one of the most common physical causes and can be preventable, unavoidable, or unsuspected. Preventable muscle abuse involves a specific action that can be stopped, like lifting with your back instead of lifting with your knees. Unavoidable muscle abuse comes from accidents like falls and fractures. Unsuspected muscle abuse can involve side effects from certain medications, complications from scar tissue, or immobility from being in a cast or a sling. Beyond muscle abuse, physical causes of trigger points can include abnormal bone structure that you are born with, poor posture, poor sleep, and living a sedentary lifestyle, to name a few. Other non-physical causes of trigger points could be vitamin deficiencies, chemical imbalances in the body, infections and viral disease, or psychological factors like anxiety and depression, which brings back the importance of mindfulness and meditation like we talked about last week. Safety is key for effective trigger point management and for preventing future injuries. When performing self-massage to trigger points, you need to be able to complete each session without straining or exhausting your forearms. You also need to be able to complete each session in a way that actually has an effect on the trigger point, instead of using energy massaging the wrong spot. Daily consistency is very important for success with trigger point management. Be sure to perform your self-massage every day. To help keep you on track, we recommend using a trigger point journal to record the date, where the trigger point is, how you massaged it, and how many sessions you performed. If you find that your pain or trigger points have not gotten any better after a week or two of consistent self-massage, you may be massaging the trigger point too aggressively, or you may be treating the wrong spot. The next slide describes very specific guidelines for self-massage. If you are interested in trying trigger point self-massage, we suggest you get a pen and paper so you can write them down and keep them in a convenient place. There are multiple ways to treat trigger points, but today we will be teaching you the best combination: heat, self-massage, and stretching. The following are 10 rules for effective trigger point massage. If you need to, pause the video so you can take your time to read or write what you need to. Number 1. Start with heat, finish with stretching. Applying heat before self-massage helps relax and loosen the muscles so that the massage is more effective. You can use a hot shower, a hot pack, towel, or anything else that can safely warm your muscle. After a self-massage session, you want to stretch the muscle where the trigger point is. We will talk a little more about stretching in a minute. Number 2. Use a tool whenever possible to save your hands. Trigger point self-massage can be a lot of work on your hands, and some muscles of the body are too dense for the hands to do much good at all. we recommend using a tennis ball or a Theracane in place of your hands. You'll be able to see examples of when and how to use these tools later on. Number 3, use a deep stroking massage. Do not be afraid to use pressure. Trigger points are deep inside the muscle, so you need to get a good deal of pressure to reach them. Number 4, massage with short, repeated strokes from one side of the trigger point to the other. Make sure to pass directly over the trigger point, preferably in the same way each stroke. Number 5, perform each stroke in one direction for best ergonomics. Most people are familiar with massages being performed in small circular motions. However, for trigger point self-massage, massaging in a straight line is best. Ideally, you should only massage in one direction instead of back and forth, but this can be tricky to do sometimes. So it's okay to go back and forth as long as you are massaging in a straight line. Number 6, during self-massage, aim for a pain level of 5 on a scale of 1 to 10. The massage might make you a little sore or tender after, but it should still feel good. Number 7, perform each stroke slowly for about 1 to 3 seconds each. Number 8, limit each massage session to 10 to 12 strokes per trigger point. Each session should only take about 1 minute. Number 9, work a trigger point 3 to 6 times per day. Start with 3 sessions per day and work your way up to 6 when you feel you are ready. Number 10, remember, if you are not getting any relief after a week or 2 of consistent self-massage, you may be working the wrong spot. Here is an example of the tennis ball and Theracane techniques. Theracanes can be bought on Amazon.com, at Walmart, and at Target, to name a few places. After completing a self-massage session, stretching the muscle with the trigger point is extremely beneficial. If you think about it, it makes sense. You spend time relaxing the muscle with heat first, then you work the trigger point with self-massage. Then, when you stretch afterwards, you help the trigger point unwind and relax too. Stretching should feel good, not painful. It is important to keep the stretch slow and fluid. Do not bounce during the stretch. Think of stretching as lengthening your muscle. It should provide better range of motion over time and a greater sense of ease. This is the end of part 1. Move on to part 2 to see self-massage techniques for specific muscles all over the body.